Hello everyone, my name is Susan. I'm a student at the University of Texas at El Paso in the Master's Program for Education in Nursing. Today I will be talking with you guys about prostatic disorders and erectile dysfunction. I have set up a slideshow for you, but we will go through each slide individually to allow time for questions and thorough explanation. Let's get started. As we go through this presentation, feel free to ask questions, and we will go over whatever we need to help all of you understand the disorders of the prostate. First, let's look at 4 different diagnoses for prostatic disorders. There's prostatitis, benign prostatic hyperplasia, prostate cancer, and erectile dysfunction. Let's start with the first one. Prostatitis. What is it? Prostatitis is an infection of the prostate gland. It can be acute, which means it generally happens once, maybe twice, but not very often at all, or chronic. Chronic means you have recurrent episodes of prostatitis. This is usually a bacterial infection, and sometimes it can be caused by non-bacterial agents. Prostatitis is the #1 urological disorder of men. It affects the prostate gland. Prostatitis can be inflammatory and non-inflammatory. Up to 15% of men experience prostatitis. If you look at the picture, you can see a healthy prostate versus an inflamed prostate. The inflamed prostate is prostatitis. If you look at the picture again, you can see where the bladder is and where the urethra is. This is the tube that your urine comes out of. When a person experiences prostatitis, that urethra tube is narrowed and it becomes much more difficult to urinate. This can be very painful. There are 4 different types of prostatitis that men can experience. There's acute bacterial prostatitis, chronic bacterial prostatitis, chronic proctitis, which is also known as chronic pelvic pain syndrome, and asymptomatic inflammatory prostatitis. Acute and chronic bacterial prostatitis. In acute and chronic bacterial prostatitis, the prostate is invaded by bacteria. The prostate then becomes inflamed, and as you can imagine, is often very tender and painful. The lymph nodes and bloodstream surrounding the prostate can be infected as well. Chronic prostatitis is a recurrent condition. This means it happens more than once and happens several times over. Acute prostatitis is not. Usually with acute prostatitis, this is an occurrence that happens once, maybe twice, and that's it. Some common bacterial organisms of chronic prostatitis and acute prostatitis include E. coli, Klebsiella, Pseudomonas, chlamydia, gonorrhea, and/or group D streptococci. Chronic prostatitis is a condition to this day that has unknown etiology. It is also called chronic pelvic pain syndrome. In chronic prostatitis, there is prostate and urinary pain despite no infection noted. Again, the etiology of this is unknown. Some think that it might occur after a viral illness, and others think that it may occur to a sexually transmitted disease, or STD. Another unique prostatitis condition is asymptomatic inflammatory prostatitis. In this type of prostatitis, the person has no symptoms, even though their prostate is inflamed. Usually, diagnosis does not occur until the individual is in for some sort of urinary complication, because as you can imagine, it's probably hard to urinate when your prostate is enlarged, but yet the person has no pain. The cause of this is also unknown. When treating prostatitis, the drug regimen of choice will be antibiotics. First choice will be antibiotics such as Septra or Bactrim, and you may see Cepra or Levaquin as well. Second choice, doxycycline. However, do not take if you are allergic to sulfa or macrolides or any of the above antibiotics. Please notify your physician if you have any allergies to these medications. Some common side effects of these medications include GI distress, headache, or nausea. Something that is very important about antibiotics, you always need to take the prescribed amount as ordered by the doctor for the full time frame. Even if your symptoms improve or go away, continue to take the medication as ordered by the doctor. So now you're probably wondering, well, how will I know if the treatment is working? How will I know if these antibiotics are helping? Well, it takes a little bit with prostatitis, but usually you should start to feel improvement within 7 days. However, it may take up to 14 days before you really note a difference. In some cases, 12 weeks of medication may be indicated. Again, take the medication as prescribed for as long as it is prescribed. Do not stop halfway through or as soon as you feel better. You may need follow-up cultures just to verify that there is improvement and that the bacteria is resolved. Pain and swelling should decrease within 7 to 14 days, and you should be able to urinate much easier within that 7 to 14 day time frame as well. Some education on prostatitis. Taking a warm bath can help with discomfort. Take all medication as prescribed by the doctor. Please let the staff know if you have any financial constraints as far as getting the medication and treatment that you need. There may be coupons out there may be free samples, there may be lots of options, but if we do not know how to help you, we cannot help fix the problem. If acute urinary retention develops, you need to see a doctor or go to the ER immediately. You cannot allow the urine to sit inside your body. Physical therapy may be recommended. And remember, drink lots of fluid, lots of water. Help flush this bacteria out of your system. It will really help things improve quicker. Our next topic will be benign prostatic hyperplasia. This is also known as BPH. As you can see in the diagram, you have a normal prostate with a bladder off to the left with a normal urethra. On the right, you have an enlarged prostate. Kind of looks like a lot of lima beans or peanuts put together. You have the bladder on top, and as you can see, the urethra is compressed to almost obstructed due to the enlarged prostate. BPH is the most common urological problem in men. 50% of men greater than 50 are affected. And if you look at the chart to the right, you can see that the prevalence of BPH only increases with age. The cause of BPH is unknown. The prostate gland is enlarged, as you saw in the previous diagram. However, having BPH does not make you at risk for prostate cancer. The pathophysiology of BPH. It is thought that as men age, they develop less testosterone and actually have an increase in estrogen. And this change in hormones is thought to be a factor that can lead to BPH. BPH usually develops inside the prostate. The enlarged prostate glands limits the urethra opening. Symptoms are actually due to the limited urethra opening and pain with attempts to urinate. Obesity and family history may increase BPH chances. Urinary retention and obstruction are the most common symptoms. Medication options or drug regimen for BPH. If you look at the chart on the right, you can see there are some medications approved for treatment of BPH. What I did on the left-hand side was translate those medications into words that are more common that you guys have probably heard of, either by commercial or perhaps that some of your friends are taking. These medications include Hytrin, Cardura, Flomax, Avodart, and Proscar. Potential side effects of these medications include orthostatic hypotension, which is a condition that when you stand up, your blood pressure drops and you become dizzy or lightheaded. Some people can fall due to orthostatic hypotension. So if you stand up and you feel dizzy or lightheaded, please sit back down. You can also experience a headache and decreased libido. Some people also have problems with ejaculation. Patient treatment for BPH. Your blood pressure will need to be monitored closely for the first 2 weeks to ensure no orthostatic hypotension occurs. You should begin to feel a decrease in symptoms, and this will be a sign that the medication is effective for your therapy. Pain should decrease and minimize. Urinary restriction should resolve. Sexual complications, if there were any, should also resolve. Please note, if any side effects occur, as noted on the previous slide, such as decreased libido or ejaculation issues, you need to change your drug regimen. Please notify your doctor right away if any side effects occur. Some education on BPH. Please remember, it may take up to 2 weeks for symptoms to improve. Continue to take all your medication as ordered by your doctor. Change positions slowly. Sit down if dizziness occurs. Avoid alcohol and diuretics when medically approved. Limit fluid intake a few hours before bedtime. Remember, a healthy weight and a healthy diet can improve BPH symptoms. And drink plenty of fluids during the day, especially water. Prostate cancer. There are 4 stages of prostate cancer. Prostate cancer is the most serious of all the diseases we are discussing today. Prostate cancer can be fatal if not detected early enough. In looking at the chart, there are 4 stages. The yellow portion inside each prostate represents the cancer cells. The green portion of each chart represents the lymph nodes. If you look to your left at stage 1, there is a very small amount of prostate cancer noted. Stage 2, there's a little bit more. Stage 3, there's even more. And by stage 4, there are multiple cancer cells within the prostate and within the lymph nodes. What is prostate cancer? Prostate cancer is a malignant tumor of the prostate gland. Malignant means it will spread and it can be fatal if not treated in time. This is the most common cause of cancer in men. The exact cause of prostate cancer is unclear, but age is a factor. 1 in 5 men will develop prostate cancer at some point in their life. A family history can predispose you to prostate cancer. For example, if your parent or a grandparent had prostate cancer, you are at risk for developing prostate cancer. Also, if you are African American, you are also at a higher risk for developing prostate cancer. The pathophysiology of prostate cancer. Prostate cancer is usually a tumor that is slow growing and free of symptoms. Unfortunately, these symptoms tend to present during advanced disease process, such as in stage 3 or stage 4 on the previous slide. Symptoms include urinary complications. As you can imagine, as the cancer grows around the prostate and the tumor becomes larger, the urethra tract becomes smaller and obstructed. This causes painful urination, limited urine stream, or frequency. Frequency is when you keep going to the bathroom, you feel like you have to go and only a little bit comes out. And the reason behind this is because a lot of the urine remains in the bladder because it is restricted from the limited path of the urethra. A person can also experience constipation, large bowel obstruction, and lumbosacral pain. This chart shows some drug regimen options for prostate cancer. In the early stage, first-line therapy may be surgery or radiation. Second-line therapy may be anti-androgen therapy. However, as things continue to get worse, chemotherapy will most likely be involved, along with radiation. As mentioned on the previous slide, for drug regimens, surgery may be a very real option if you have prostate cancer. And this is where the physician will do a surgical intervention on the prostate itself. You may also have to undergo radiation and/or chemotherapy. Again, early detection is key in prostate cancer. On the right-hand side, again, is another example of a normal prostate, and below it is a prostate with cancer inside of it. Treatment monitoring of prostate cancer. It is important that your pain is managed during this process, as prostate cancer can be very painful. It is also important that you remain active in your personal treatment plan. You may be looking at a lot of options and difficult choices during this time. Please, if you can, involve your family in the treatment planning. Your family wants to be there and they do want to help. So please include everybody in this process. Have a clear understanding of the therapeutic goals and plans that you make. Be aware of how the disease process and treatment will affect sexual function. You will also need to try to maintain an acceptable bladder and bowel management program, as prostate cancer does have an effect on the bladder and the bowel. Prostate cancer education. I cannot stress enough how important it is to get an early diagnosis of prostate cancer. If you guys have not had a prostate cancer screen, I want each of you to go home today, schedule an appointment with your doctor, and go in tomorrow. I'm not kidding. This can be a silent killer. You need to have a prostate screen exam every year. When they do a prostate screen exam, one of the things they look for is called a prostate-specific antigen test. This test lets the doctor know if you are at risk or possibly have prostate cancer. For men over 40, a normal PSA reading is 4.0. You will need to avoid ejaculation 48 hours prior to the PSA test. So please, when you schedule this appointment, ask your doctor if they will be performing a PSA test during that visit, which they most likely will. Please remember, prostate cancer can be fatal if not found early. Please, please, please go for your screenings every year. Our next topic of discussion will be erectile dysfunction. As you look at the chart, you can see the anatomy of the penis. This is important for all of you guys to know during this conversation. As you can see, the penis has many nerves in it. And in erectile dysfunction, these nerves actually have a direct impact on the penis not being able to elevate. This is something that we will discuss further in the next few slides. What is erectile dysfunction? Erectile dysfunction is the most common sexual complication in men. And I'm sorry guys, older age is a known cause. It is the inability to obtain or maintain an erection long enough for sexual satisfaction. As you can imagine, this can affect a man's self-esteem, his relationships, and his personal well-being. More than 50% of men ages 40 to 70 develop some form of ED. Some of the many risk factors for ED include advancing age, smoking, comorbid diagnoses, and by this I mean where you already have a previous chronic diagnosis, such as diabetes or a type of cardiovascular disease. High blood pressure, obesity, drug use, and stress can also be a factor for ED. This is a simple chart of the causes of erectile dysfunction. As you can see, there are many different causes for erectile dysfunction, and as you look at the chart, you can see what percentage each one of those causes. The pathophysiology of erectile dysfunction. As mentioned earlier, the erection of the penis involves many nerve impulses. Any separation of these nerve impulses can cause ED. Side effects from medications being prescribed or illegal can cause ED. Vascular changes from aging can cause ED. Trauma, chronic illness, depression can all cause ED. One thing to remember, erectile dysfunction can actually be a symptom of undiagnosed cardiovascular disease. Drug regimen for erectile dysfunction. There are medications to help maintain erection. The first line of therapy is a lifestyle change if needed, as well as prescribing a PDE5 inhibitor. Some of the medications included as a PDE5 inhibitor include Cialis, Levitra, and Viagra. Some side effects of these medications include headache, flushing, and GI upset. Please note, if the medication above is not successful, you need to see a urologist. In some cases, injections directly into the penis is effective in helping with erectile dysfunction. Treatment monitoring for erectile dysfunction. Some of the ways that you can tell if the treatment plan is helping is improved sexual performance as well as satisfaction. Your ability to maintain and withstand an erection are also important. Strong family support and understanding is also very important in the treatment monitoring process. And an overall improvement in personal well-being should be observed as the treatment process continues. Patient education for erectile dysfunction. Limit high-fat foods as this interacts with your medication. If side effects occur, notify your doctor immediately. Do not take Viagra and nitrates. This is also sometimes called nitroglycerin. Your blood pressure can drop. Maintain a healthy lifestyle and diet. Please include your loved ones in your healing. Allow them to understand your diagnosis and help you through the process. This concludes my presentation on prostatic disorders and erectile dysfunction. The main purpose of this is to give you guys some education on possible prostatic disorders that may occur as you guys get older, and the importance of seeing your doctor on a routine basis. If nothing else that you got out of this presentation, please remember, see your doctor yearly for a checkup, and please have your prostate cancer screen every year. I wish you guys all the best, and if you have any questions, I'll be glad to go over anything. Thank you so much. Bye.